Hi doctor friends, welcome to my YouTube channel PG Doctors INDRANJU. Before starting the femoral triangle, which are most important for your nearby AIIMS PG exam, DNP and FMGE exam, this is very important topic due to the many structures passes through this region, and most important thing that one question always be asked in your all types of medical PG exam. So let me try to elaborate this femoral triangle so that you can easily appreciate this. Let us start. The first of all, femoral triangle is the triangle which are in the anterior region of the thigh below the inguinal ligament. So first of all, the inguinal ligament. Inguinal ligament is between the pubic tubercle to the anterior superior iliac spine. This is the pubic tubercle and here the anterior superior iliac spine. That means this is the hip bone and it is the iliac bone, and below that anterior inferior iliac spine. Above this anterior superior iliac spine, there is connecting a ligament is known as inguinal ligament. This is infolding of the external oblique abdominis muscles here, and you can easily watch this triangle. The triangle is between the muscles and the floor of this triangle. All I will elaborate in this video. Here, first of all, the femoral triangle, the boundary of that, the muscles situated in the anterior region of the thigh is the medialmost is this is the gracilis muscles. Then after the adductor magnus, after that here the adductor longus, which are adductor longus, adductor longus. Then after this is the magnus and this is the gracilis muscles. After that, this region of the muscles are called as pectineus, and after that pectineus, this is the psoas major. After that, this is the iliacus. Above that is the inguinal ligament, and the lateral to that, this is the sartorius muscle. The sartorius muscles is attached to anterior superior iliac spine, and also there is inguinal ligament attachment. Here the triangle is made between the where the anterior superior iliac spine, there is inguinal ligament and the sartorius muscles start. This triangle is looks like that. Here this is triangular structure. So according to the diagram, the medial, this is the medial border, lateral border, and it is the base region, and here it is apex. So the base is formed by the inguinal ligament. Medial border is formed by the adductor longus. This is the adductor longus. So the medial border of the adductor longus is made the medial border, and here the sartorius muscles and medial border of the sartorius is made lateral border. So this make a triangle. So this is known as femoral triangle due to in the region of thigh. And the apex is formed by the sartorius and the adductor longus, which both merge at the point known as apex of the femoral triangle. This is the boundary of femoral triangle. The femoral triangle looks like a triangular structure. This is, and this downward goes to medial side and open in the hiatus of the adductor magnus, and this is called as adductor canal. So we have to focus on the femoral triangle. The base structure is formed by the part of the adductor longus, pectineus, psoas major, and the iliacus. Here, this is the structure of the femoral triangle. The lateral to the sartorius muscles, there is vas rectus femoris. After that, behind the rectus femoris, the vastus muscles, that means vastus lateralis, intermedius and medialis are situated, and lateral to that, this structure is called as the tensor fascia lata. This is this muscles, and the structure that are in the femoral triangle is this is femoral vein, femoral artery. This is the femoral artery, and lateral to femoral artery is the femoral nerve. This structure are the femoral nerve, and here this is the inguinal ligament. Underneath the inguinal ligament, the structure are that this is the lymph node structure, which are entered through the femoral sheath. This greenish structure is the femoral sheath. In the femoral sheath, these are the lymph node. After that, this structure, bluish structure, is called as femoral vein, and a branch of femoral vein, which are saphenous, great saphenous one, which entered to the sheath, and this is femoral sheath, and this continue to the femoral vein, this, and after that this is the femoral artery. Here the femoral artery and the branch of the femoral artery here are, this is the profunda femoris artery, and a branch of that is the lateral circumflex femoral artery, and above this is the branch is the superior circumflex iliac artery, and above the inguinal ligament it is the superficial epigastric artery. The region is very important due to this structure are in between them. The boundary of the femoral triangle already told that base is formed by the inguinal ligament, and apex is point where lateral and medial border meet. That means this is the apex, this is the apex region, and this is the base region. This is the base region, and already told this is medial boundary, this is the lateral boundary. And floor already told that floor is formed by adductor longus, pectineus, psoas major and iliacus, and roof is formed by the skin, superficial fascia. Superficial fascia includes superficial inguinal lymph node, femoral branch of the genitofemoral, and femoral branch of ilioinguinal, and superficial branch of the femoral artery, and deep fascia. The content of the femoral triangle is the femoral artery and its branches, femoral vein and its tributaries, femoral sheath, nerve are the femoral nerve, nerve to pectineus, and femoral branch of the genitofemoral, and lateral cutaneous nerve of the thigh, and deep inguinal lymph node. These are the content of the femoral triangle, and already told that the femoral triangle continue as the adductor canal which open in the adductor hiatus. So thanks for watching my video. Have a nice day.